Achilles tendinitis, or Achilles tendinopathy, is a common cause of lower leg pain among active adults. In this video, I explain what it is, the common signs and symptoms, and common and innovative treatments to help you recover and return to sports and exercise. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, Achilles tendinitis has been the common term. It's really more of what's called an Achilles tendinopathy. We all know what the Achilles tendon is in the back of our ankle, attaching basically our calf muscle to the heel bone. And it helps us with push-off strength and pushing forward as you're walking, going upstairs, jumping, things like that. And it can be a common overuse injury in active people like runners. They're the ones that typically get it. People in their 40s and 50s that just get this aggravating pain in the back of the ankle. And yes, it can start as a tendinitis, meaning that tendon is just inflamed, or maybe the sheath around the tendon is inflamed. But very often, after a few weeks or months, especially if it's a lingering problem, instead of an inflammation, what you actually get is a small area of degeneration within the tendon, a tendinosis or tendinopathy. That's where those terms come from. And then that's where issues like, or treatments like anti-inflammatories wouldn't be helpful because they're not treating the underlying condition. Now, you also don't want to use cortisone injections or steroid injections around the Achilles tendon because that can weaken the Achilles tendon, and actually make it more likely to rupture. Typically, the early phase of this is short-term backing off or rest from whatever the offending activity or sport or exercise is. Short-term can be ice and a lot of physical therapy and eccentric exercises specifically. And I usually recommend physical therapy pretty aggressively because I feel like they can get you better quicker than just time and rest can do it. It involves not just working with them, but doing the exercises at home every day on your own or several times a day to try to get better. And for a huge percentage of patients, that's enough to get it better. But sometimes it just lingers into a continuing pain. And that's where some of the regenerative treatments have been thought to be helpful, like injecting platelet-rich plasma into the area of tendinosis to try to get it to heal. Some people have suggested exosomes. Some people have suggested peptides to try to get the tendon to heal, whether that's BPC 157 or thymosin beta 4 or something like that. Again, those are considered experimental, so I'm not going to say that that's something that I would recommend, but I just know people a lot of times use those for that process. Now, Achilles tendinitis or tendinopathy and PRP, platelet-rich plasma, there is a decent amount of studies for that, so that's a fairly accepted treatment. The others are more, like I say, what are considered experimental. Very rarely does this actually go on to need surgery, but sometimes you can have so much tendon that's involved, that's degenerated, so large an area of tendinosis or tendinopathy that none of those treatments work, and you are typically talking about surgery. The surgery really depends on exactly the nature of your problem, but a lot of times it's cutting out the diseased part of the tendon and trying to then just reattach it, or sometimes swinging a different tendon around and basically recreating that part of the Achilles tendon. So it really gets to figuring out exactly how bad the problem is, the nature of the particular condition, and then what treatments would get you there. Hopefully not involving surgery, but that can be sort of a last resort treatment. Now, I'd love to hear about your experience with your ankle injury, Achilles or otherwise. Leave those in the comments below. Just understand, I can't offer you specific medical advice there, but I do try to collect the topics in those questions for ideas for future videos. Make sure to subscribe to my channel to be notified when I release a new video like that, and when I start another live stream like my Ask Dr. Geier live shows. If you have ankle, knee, hip, shoulder, or some other joint pain and you want to get significantly better in the next 30 days without cortisone shots or surgery, you can learn more about working with me in the description below. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.